Hi, my name is Shahad. I'm the doctor today taking care of you. How are you, Mr. Seddon, correct?
Yes, I am.
Nice meeting you. The reason I'm here is because you've been diagnosed actually with COPD, unfortunately. Do you know what that is?
No, I do not.
COPD is an abbreviation for chronic obstructive pulmonary disease. And what that means is that your lungs have a long-term, lifelong disease that causes your lungs to be inflated, and inflamed, actually, sorry, inflamed. And what that does is make it thick and thickened and stiff, kind of. That is happening because probably you've been smoking. Have you been smoking?
Yes,
Okay, most COPDers actually get COPD because they've been smoking for a long time. And how long you've been smoking, you said?
30 years.
30 years. Are you planning on quitting? Have you ever tried anything?
I've tried, but I ain't make it too long.
So you gotta have to quit that smoking because it will make it worse for you. Did you get any shortness of breath? Have you been in the hospital before for that?
Yes, I have.
Okay. Well, we have some medications that helps you with maintaining day-to-day life with that, and having you breathing better. These medications will reduce that inflammation. It will help you breathe better and help the oxygen that you need while breathing to get into your lungs. It will make it easier for you to breathe, and then that oxygen will go properly to your body. Because COPD does that thickening I told you about, that happens in the tissue of your lungs, does cause the oxygen not to be delivered to your body correctly when you breathe in and out. Okay?
Okay.
So we have two types of medications. One is called Eldro, one is Brio. These two will be demonstrated for you by Respiratory, and I have two different respiratory therapists. They're really good, and they will help you with that. One last question. Do you use oxygen at home?
No.
You don't? Okay, well that's good. We don't want to get to that point. You want to use these medications like ordered and, keep up with that. Try to quit, and if you need any help quitting, we are here for you as well. Do you have any questions for me?
No, I think I understand. Yeah.
Okay, well we're here if you need anything, okay?
Okay.
Alrighty, it was nice meeting you.
All right, thank you.
Knock knock.
Hi.
My name is Haya. I'm from Respiratory. Your doctor ordered medication, so I'm gonna show you how to use that medication and what does that medication to you. Okay?
Okay.
Okay. This is albuterol. It's a rescue medication. It's gonna help to open up your airway. It works fast and relax your muscle. Okay? You take this only if you have shortness of breath or difficulty breathing, okay? You don't have to take it every day if you feel fine, yeah. Okay, so if you got the first time is this albuterol, always you have to prime 2 times before you use it, okay? That way to just to clear the dusts that's gonna help to clear the dusts, okay? Okay, every time you use it, shake it very well. Okay, shake it very well. And this is a spacer. We use this albuterol with this to help the medication to spread, not to spread everywhere. Okay, just go straight in our lung. Okay, so prime it. Shake it very well, and put it here on the spacer. Okay, open this and hold it like this. And before you put it in your mouth, exhale the air out and put it in your mouth and puff, 1 puff, and take a big deep breath and hold it 5-10 seconds. After you take a big deep breath and hold your breath like 5-10 seconds. In that way, just the medication goes straight in your lung and stays there when you hold your breath and take a big deep breath. So this medication you take 2 puffs So 1 puff at a time. In between, between 2 puff, we wait 1 minute. Okay. So you just after you take one puff, you take 1 minute, and you demonstrate the same thing for the next one. Okay. Do you understand what I'm?
Yes, yes, I believe I have it.
Okay. This medication is gonna, since this is a rescue medication, so you're gonna have to take it everywhere with you, with the spacer, of course. Just in case if you don't have a spacer or if you forget the spacer, I'm gonna show you how to use it by itself. Okay.
Okay.
So we use our 2 fingers to measure the distance, how far we hold it, like this. We open this and put the finger here, and this is how far we hold it
from the mouth.
Yes. So we just slightly we take off the and open your mouth, and 1 puff. Ten seconds, and we wait 1 minute for the next one, for the next puff. Okay. Can you show me how to use it?
Yes,
To see.
let's Okay, I shake it first. Then I take it off. Pump it once,
2
times.
Yes.
Pump it 2 times. And I put it in here. And exhale.
Good job.
And inhale. When I inhale it, I hold it 10 seconds, you say? 10 seconds?
Yeah, 5 to 10 seconds. You hold your breath, and that way it's gonna, the medication goes to straight in your lung and they stay in there.
Blow it out. Okay, and then the next one, then I repeat it after 1 minute.
Yes, of course.
Okay.
Good job, you got it.
And if I forget the
This-
spacer,
Goes to here.
yeah, and if I forget the spacer, then 2 fingers,
Mm-hmm.
move the 2 fingers, exhale, and then hold 10 seconds again.
Yes, take a big deep breath in and hold 10 seconds.
Okay, I think I believe I have it. Now, where do I get the medicine from?
From your pharmacy.
The pharmacy?
Yeah. And I think they'll, for the first time they will give it to you from here. You take it from here. But for the next, every time you finish at your pharmacy, I think it's
Go back and
Yeah.
get refill.
yeah. And okay.
I think I have it.
Yeah. You have another medication, so my partner will demonstrate to you. Okay.
Okay.
Thank you. I didn't know.
How you doing, Mr. Tony? My name is Charles. I'm with Respiratory as well. I'm going to be teaching you about this DPI. And what this is it's a daily, it's to manage your COPD. It's a maintenance drug. And this has 2 drugs in it. And one's a steroid and one's a LAVA, which is a long-acting beta agonist. I know you don't understand what that is, but what it does is it relaxes the smooth muscles over a period of time as it builds up in your system. And since you have inflammation, the corticosteroid is going to fight that inflammation and keep those lungs healthy, so you won't. It'll hopefully prevent you from having to use that the albuterol that she just demonstrated to you. And let me demonstrate it for you real quick. And so this has numbers on here. Can you see those numbers? You see them?
Yes, I see them.
So when I open it up, those numbers move. So what you do is when you take this, you breathe out all the air out, and you put it up to your lips, nice seal, and take a nice deep breath in, and you want to hold it for 10 seconds. And you're only taking it, you hold it for 10 seconds, and then just relax. So that lets it deposit, go deeper into your lungs. And so after you take this, what you want to do is you want to take some water and you want to drink it and rinse and spit, because it's going to prevent thrush or any fungus, because that not the anti-inflammatories, but that corticosteroid affects inflammation. So, and when you use it, you want to make sure after you use it, you want to wipe off the top of it and put it back. I would suggest putting it by your toothbrush. So in the morning is the first thing that you do. So you take your medication, This is your maintenance drug. This is what you want to do every day, because we want to keep you from having to use those inhalers. Because if you start using those inhalers more frequently, then you know your problem's getting worse. But because you haven't been maintaining your condition with this, because this is new to you, and I know it's a lot for you. But thank you for allowing me to show you and demonstrate this, and my other partners demonstrating. I appreciate your help, helping you. All right.
Alrighty.
Thank you.
Okay, you're welcome.